Good afternoon, everyone. As a volunteer of Chat and Chew, it is my pleasure to introduce to you Dr. Monica Aggarwal. Dr. Aggarwal is presently Director of Nutrition in Cardiovascular Medicine and an adjunct professor of medicine at the University of Florida. She practices as a preventive cardiologist. She is an author, an athlete, and a strong believer in diet over drugs. She recently published the book, Body on Fire: How Inflammation Triggers Chronic Illness and the Two Tools We Have to Fight It. A special note is that Dr. Aggarwal has suffered illness. She has rheumatoid arthritis, which she treats with a whole food, plant-based diet. Dr. Aggarwal, I have been afforded the opportunity to ask you the first question. On page 5 of your book, you begin to tell your readers how your daughter saved you. So my question is, would you please explain to our audience how your daughter saved you? Doctor?
How are you guys? Good to see everyone.
Tell everybody what you're doing while you do this, just like Dr. Greger.
I know, I'm sorry that I'm so crazy, but I love to exercise and I don't get a whole lot of time to exercise. So I have 3 kids and I run around like a mad woman sometimes. So in order to get my exercise in, I often will row during a meeting. So you're going to hear me rowing a little bit. You might hear the water a little bit, but I do this a lot, so it shouldn't bother the recording.
Okay, great. Thank you so much, Dr. Aggarwal. Gary asked you in the introduction of you to tell about your daughter, because you've talked about in the book about how she saved your life. So could you relate that story for us?
From the beginning, like how things started and with my illness, is that what you mean?
Yes.
Sure. So good to see everyone. Some of the names on that podcast I recognized, which was cool. I mean, on the Zoom, some patients or people I know I've recognized. Good to see you all. So, I am now 10 years since my diagnosis of rheumatoid arthritis. Can you guys hear me okay?
Yes.
Thank you. So I have I've always had a bit of a crazy life, mostly because I've done that to myself. I decided to become a cardiologist. Cardiologists, women, 12% of cardiologists are women. There's so few of us because it's not very female friendly, and that's improved over time, but not by much. It's still about 12% of cardiologists are women. So when I was in training, I felt this great need to not take time off during my training because it wasn't looked on well. When you're a doc, all your partners and your co-trainees are all boys and men, and they don't understand, oh, I need to take 3 months off for maternity leave, let alone take 1 extra call for someone else. And I get that, because it is hard. It's a hard time, and we're all in training and we're all exhausted, and taking 1 extra call just seems like too much. So I really get it. So then, because of that, once I finished my training, I felt this need to have kids all in a short amount of time. So I had 3 kids in 4 years. So I always tell that story and when I laugh, because I had a 4-year-old, a 2-year-old, and a newborn. So I used to come home from work and there would be a baby put on my breast, a baby that would jump into my arms, and then a baby attached to my foot. And that's sort of how my life was. But it was a great life. The problem is your body can only sustain so much. And so I was sleeping 4 or 5 hours a night. I was working full time. I was managing 3 kids. I was nursing. I was pumping. I was pureeing sweet potatoes. I was trying to make cupcakes at midnight. I mean, it was just a crazy time. I remember times where I'd be breastfeeding and answering calls for heart attacks. And then I would have to hurry up the baby to finish eating so that I could then run to the hospital. So that's how my life was. And every time you do this to yourself, your body falls apart. We think that it won't, but it will. So about 4 months after I had baby number 3, I started manifesting migratory joint pain. It started at a finger, quickly went to the next finger, to my other hand, my shoulders. Within 2 weeks, I went from being an active runner to being almost completely immobilized. I couldn't even walk up the steps. I was diagnosed with a debilitating form of rheumatoid arthritis. And I was told that overall my prognosis was very poor. So I needed to get on medications pretty much immediately. So the doc gave me a week to come off of my to stop nursing the baby so I could get on medication. So I did it. And I got on medications and my joints started feeling better. But I had a whole host of side effects, which I talk a lot about in the book. And the reason Kat mentioned talk about your daughter is because I felt a lot of sadness and anger towards my 3rd kid, because I wondered if I hadn't tempted fate, if I hadn't tried to have a 3rd child, that maybe I wouldn't have gotten sick. And I carried a lot of anger. And it took me time to understand and realize, because it was because of her and that I'd gotten sick, that I changed my whole life, right? I learned about eating, I learned about healing, I learned about stress, the impact of the gut. And if it wasn't because of my illness, then I would never have gotten better. And so the irony of it all is that she's the one who showed me the path to getting better. So I am now almost 10 years out from diagnosis, and I have been on no medications for over 8 years. And I have no joint destruction.
Yay. And you're an athlete.
Me rowing.
Oh, you are an athlete in rowing. Okay, boy, that's quite a story. Before we start questions, I think we want to be sure everybody knows that you can ask her a question, and you can do it in our chat. And we've got people that are there to monitor it and ask the questions, so that should go. I just want to check on chat. Could you let us know? Can you hear Dr. Aggarwal when she talks? Did it sound okay to you? I mean, I know you can hear the row machine, but that should be all you should hear. That's a little different. So let's see if we've got a good sound check here. Okay, everybody's saying it's good. Vicki, you may want to check and make sure you're not looking at YouTube, because that's why you would hear it twice. Yeah, I'm getting good response.
It just suddenly stopped.
Okay, well, good. Whatever it was, we'll be glad it stopped. All right, well, Dr. Aggarwal, you know about inflammation, obviously, because you've been through it with your rheumatoid arthritis. And in your book, which, by the way, is tremendous, there happens to be a bunch of really good questions that popped out at me. And then I heard you do some presentations. So I've grabbed a couple of your slides, and I wanted to just have you talk from the slides, if you would, about inflammation. I love this quote from your book. Wow, we can eat and cause inflammation. So how does medicine deal with that? Because they don't look at what we eat. Can you tell us, Dr. Aggarwal, what is the traditional way of dealing with inflammation?
Well, so first you have to understand what inflammation is. Okay, great. You have my slides. Okay, so inflammation is your body's irritation. So we call that's why the name of the book is called Body on Fire, because It's your body being irritated with you and what you're doing to it. So there's some sort of imbalance between the stresses in your life and the resources in your life. And that's sort of the reason we get inflammation. So stresses aren't just emotional or physical stress, but it's environmental stress, and it's what we do to what we eat, it's how we act, how our activity level is. All of those things play a role in all of those things play a role in how we are in balance or balance. And it's that irritation of our body when there's too much demand and not enough resource that we develop inflammation. So that's the fundamental thing we have to understand. So everybody should be able to look at their life and think, what am I doing that is putting a demand on my body? And am I giving myself enough time to recover? And that's a hard question. And sometimes you have to really look inward and ask yourself, because a lot of us think, oh, it's okay, it'll be fine. I'll just sleep less today, or I won't eat as well today, and I'll do better tomorrow. Well, that works once in a while, but unfortunately that's a slippery slope. And so people will start by not eating well one day and they go, well, today, what the heck? I'm going to have another cookie. Oh, what the heck? I'm not going to exercise today. And so it just becomes this slope, and we all are guilty of that to some degree all the time. So when there's too much demand and there's not enough resources, we get inflammation. So traditionally, as doctors, we're taught to treat the inflammation with medicines that suppress inflammation. And then we treat the illness that ensues afterwards, which is what we show in this picture. We have a genetic predisposition to illness. We have some sort of trigger. Sometimes we think it's lifestyle. We call it the second hit. That's how we're taught traditionally, that there's some sort of second hit that activates the gene, which triggers inflammation, which triggers illness. So our traditional medicines are to treat the inflammation and the illness without appreciating the fact that the trigger is often something we've done in our lifestyle. So if you think of it, do you have my other slide too?
Yes, I do. Let's see if I can get it to advance. Whoops, went one too far. There it is. How's that?
So if you look at it differently, if you treat people at the lifestyle stage, then you could potentially prevent, if you have a genetic predisposition, you won't necessarily activate or express your gene, which then you won't necessarily trigger inflammation and you get rid of your illness. So it's a totally different way of thinking. It's not treating the end result, it's treating the beginning. And that's really what we need to be focusing on doing. Even if some of the people in this group have illness already, that doesn't mean that we shouldn't be working on lifestyle as well, because that lifestyle is a trigger for more and more inflammation, which can trigger more and more illness. So if you treat your inflammation by lifestyle, you can potentially prevent further worsening of whatever illness you have.
And that's what you did, isn't it, Dr. Aggarwal? You stopped your lifestyle things that were causing the problem and causing the inflammation. And then am I saying it right? Your rheumatoid arthritis is at bay.
Well, that's what I think, and so if you remove your triggers, for me, my triggers were, I thought, lack of sleep, too much stress, and dairy. And those three things I removed and improved rather, then I was able to suppress the inflammation. And so for 8 years now, or 10 years effectively, I haven't had inflammation. Now I have bursts here and there where if I overdo, actually I haven't had any bursts until about a few months ago. And it was interesting because for 10 years I've had no symptoms. And about 2 or 3 months ago, I developed inflammation again in a joint, which I haven't had in 10 years. So why 10 years later am I developing joint pain? I'm going to close my door because the dogs are coming in and out. So I think that it's, a couple things that could have been, one of which was
Could it be anything on this list that you have from the graphic from your book?
Oh, sure. You know, I had just received the COVID vaccine, so that could have been a trigger. I had a throat, which could have been a trigger. You can get a reactive arthritis with a viral illness, but more than likely, it was the fact that I had just moved. I was sleeping again 3 or 4 hours a night. I was eating vegan and healthy, but not super healthy. I had gone back to eating a little bit more processed in the middle of the move. I wasn't exercising, and I certainly wasn't sleeping. And so once again, I triggered my inflammation. And so you're never protected completely. You always have to be on guard. Like there's never a moment where you can say, oh, well, I'm not going to be mindful, because you have to always be mindful of your illness and your risk. And so when I say once in a while, I don't care. But what had happened to me is for several weeks, I just allowed my demands to completely outweigh my resources. And so the inflammation started again. So
wow.
For about 4 weeks, I pummeled everything. I went back to my old ways, went back to healthier eating, sort of added in the foods I know are fermented natural probiotics. I changed a lot of things again, and the inflammations again have gone away. But it's a constant reminder that we always have to be careful.
Okay, well, let's see now. Linda, you were monitoring the chat for us. Was there anybody that asked a question?
Yes, Gary had a question about just how important BMI is.
Yeah, so BMI is your body mass index, and it's a reflection of your height and weight. And it's unfortunately a little tricky. So it helps the average person. It's very useful. And we know that if your BMI, for instance, is over 25, that's not good. That's overweight. And if your BMI is over 30, that's considered obesity. That's the overall standard. However, if you're Asian, that BMI, based on studies, is probably too high. And really, Asians should be looking at a BMI over 20 as being overweight. The problem with BMI also is that it doesn't account for body type. For instance, a lot of men, and I don't mean to say that's not a generalization, but something we learn sort of in medicine is that a lot of men might have thin arms and legs, but they still have a central paunch or the central obesity. And so they may have a BMI that's under 25, which is in the normal range, because they have low muscle mass and they're low in the extremities. They have very thin extremities, so they have low BMI, height weight ratio, but they still have risk because they have central obesity. Similarly, people who are very muscular, they can have a high BMI, but they can just be muscle with very low fat, and they have low risk, but it will appear that they have a higher BMI. So BMI is useful, but it has to be taken with a grain of salt.
Okay. Go ahead.
I was just going to say there's a really good question about, does alcohol cause joint pain? And that's Mr. Murphy. Sorry, Mr. Murphy, I'm not sure how to pronounce your first name.
Yeah, so, most people, some people do react to alcohol, others don't. It really becomes personal and dependent on your body. It also depends on your baseline inflammation. If you're already somewhat inflamed, sometimes things can tip you over. And so that's all possible. So in general, I am not anti-alcohol. Some in the plant-based world are. I think there's a little bit of moderation in terms of alcohol, especially red wine, I think is fine. The data on cancer and is very sort of average and weak in my mind. And so I think that a little bit of alcohol is okay if you want it. But if your body doesn't like it and it's telling you, like if I drink a glass of red wine at too late in the evening, I get reflux. So I don't drink it. It's you listen to your body and you'll know what to do.
Right. Vicki, I think you had a question, didn't you?
Well, there's another question out here that was one of mine, and that is the correlation between inflammation and Alzheimer's. That's from Ken and Dorothy.
Yes, so Alzheimer's disease is another inflammatory condition. Beta amyloid protein, or that you see in Alzheimer's disease, is inflammatory. So there are studies actually in animals that if you put turmeric, which is an anti-inflammatory, and you put it around amyloid protein, and this is sort of in cellular models and in animal models, that you can decrease that protein. And so, yeah, a lot of memory loss, dementia, Alzheimer's is inflammatory. It all is. We're finding that basically all illness is tied to that one word, inflammation, which I don't know if you have my slide where I show like pretty much every illness that you can think of has that central core of inflammation. If you don't calm your inflammation, you can't heal. And your body can only take so much inflammation. Like when I got sick, how much time, how many months, how many years of beating my body up was it going to take before it fell apart? And that's the problem. So many times in our 20s and 30s, we think we're invincible. We allow ourselves to do things like, oh, we'll figure it out later. I used to wear it as a badge of honor that I pulled an all-nighter and I aced the test because it was like I could just do it without sleep. I was that good. That's how ironic it is that it's so sad because we make things that are over and above and extreme, we make them things of pride. Now I like to tell people I took I slept 8 hours last night and I took a nap at work. I'm proud of that too.
Now that one is really a different lifestyle. Good for you.
That's a good one. One of the things that a lot of plant-based doctors disagree about is the use of oil. We have some plant-based doctors that are okay with oil, some like Dr. Esselstyn and Dr. McDougall that are not. And of course, general information is that olive oil is heart healthy. Can you explain to us why that is not true?
The answer is the reason there's arguments about it is because no one knows. And so, look, all these people that you mentioned, they're my good friends. And, you know, the answer to the question is we think, but we don't know. So SE thinks that if you use oil, it affects your endothelial cells, which then prevents dilation of the blood vessel. Maybe. There's a lot of data from the Mediterranean diet that shows that even though it is an oil and a high fat oil, it's a monounsaturated fat, which is good. It's loaded with polyphenols. And in the Mediterranean diet studies, those patients ate a lot of olive oil and they did really well. Now, does that mean that if they had not had oil and they'd eaten primarily plant-based, they would have done better? I don't know the answer to that. That study's never been done. So the reason that you see here, well, you should or you shouldn't, is because we don't know. And so when people tell you that this is right or this is right, they're wrong. But because there's no data. So you have to be careful about who you listen to, because so many people are going to tell you that you have to just make sure that they're looking at the science. And so overall, the science is we're not sure about olive oil. In general, I think what you can take away from the data is that in general, oil is not good for you. However, some oils are probably better, one of which is olive oil. Now, should we have olive oil in our diet because it's good for us? Additive? I don't know the answer to that. I'm doing a study right now at the University of Florida where I work, where I'm studying the role of oil. In particular, I'm doing an olive oil study. So I'm trying to put patients on a plant-based diet and I'm adjusting their oil and I'm giving them a high amount of olive oil and I'm looking at the amount that they eat in Spain in the Mediterranean region. And then I'm giving them a low oil diet, which is what we believe is good in the sort of a lot of people in the plant-based world believe that the low oil is better. And And so I'm studying it, and I'll have some good answers by spring, hopefully. So I think that plant-based diet is the optimal diet. Eating plant-based in any form is optimal. That we have loads of data for. There's no question about it. Whether you eat a little bit of fish or a little bit of red meat or a little bit of this or a little bit, I don't really even care. I want you to focus on the fact that most of the time you're eating mostly plants. And when I say mostly plants, I don't mean you just eat beans. You got to eat loads and loads of greens. You got to eat greens till the cows come home. You got to eat some beans. You got to eat some tofu. You got to eat the whole deal. But as long as you're doing that most of the time, maybe don't focus so much on the details. If you do that, you're going to be in great shape, because we just don't have the answers to some of those other questions that everybody wants to know. And I want to know, but I'm hoping that some of the studies I'm doing at UF are going to answer those questions. So I guess, let me just say one last thing about that, is that the answer to the question about oil is, if you're happy being oil-free, great. If you want to eat a little bit of olive oil in your diet, great. Because I think as long as you're not overdoing it and you're not eating an excess amount, and 99% of the time you're doing a really good job on everything else, you're going to be great. Now, if you have heart disease, advanced heart disease, lots of stents, those kind of differences, I might change that answer, because people who might be my patients would know that sometimes I have to cut out all of their oils and all of their plant-based saturated fats as well. But that's not the norm, that's the exception.
You know, and that chapter on oil, I read very carefully. One of your quotes was, all oils have the ability to cause heart plaque. And with my family history, that's one thing I don't want to get. And I wanted to show that slide. I'm going to put it up so you can see it. Let's see, this is the one that I think is really powerful. Can you explain this one? Because you talk about lifestyle, and then if you already have a predisposition to a certain disease, how that can impact. Can you talk about that one, Dr. Aggarwal?
That's maybe the most important slide of the whole deck, because what it shows on the y-axis is calcium or plaque in the heart, and on the x-axis it shows genetic risk. And then if you look at the colors, blue is a really good lifestyle, red is a bad lifestyle. Who cares about the middle? Just focus on blue and red, x and y-axis. So if you look at somebody's genetic risk and they have high genetic risk, that means my dad had a heart attack at 45. In the past, we used to say, people often like to say, well, my dad had a heart attack at 45. I've just accepted I'm going to have a heart attack. Well, is that really true? So if you look at the high genetic risk, that's all the way on the right of the x-axis, and you look at lifestyle, you can see a difference. So let's look at that. So in the high genetic risk group, if you look at people who had an unfavorable lifestyle, they had about 60, the number 60 on the plaque score, maybe 65. I can't see it super well. And then if you had a good or favorable lifestyle, you can reduce that amount of plaque by 50%.
Wow.
So it's very important to understand that you may have genes that tell you you're at risk, but those genes don't have you. You have the ability to control it. You can reduce your risk by 50%. 50%. That's crazy. So similar, if you have low genetic risk, like the one on the left, you can see that if you have low genetic risk and a good lifestyle, your risk of developing plaque is actually quite low. That number is what, 15 or 13?
Yes.
So similarly, if you have a poor lifestyle, but good genetic risk, you double your risk of developing plaque. So it's very important to understand that lifestyle matters. You can control your genes. The epigenetics, the milieu around the genes can change based on your lifestyle. Similarly, that's what happened to me. my epigenetics. I changed the milieu around my genes. I suppressed inflammation and I made it go away.
Wow, that really, that sums it up. Okay. So I won't eat olive oil. I'm going to keep on doing that. Vicki, I think there were a couple more questions. Let's
There
see.
are.
Yeah,
There's a couple and there's two that kind of work together. One of the questions is, how do carnivores who eat a lot of meat and cheese and whatever and have a normal cholesterol level, are they as healthy, as invincible as they think they are just because their cholesterol level is good?
My favorite
And then
conversation. Okay, next one.
the next question is, what about people who do follow a strict plant-based diet and still can't get their cholesterol down?
Yeah, so let's start with 2 and then 1. So people who have, I have many patients like this that are on have a 100% plant-based diet and they can't get their LDL cholesterol down. They try and they do meticulously. That's because their genes or their genetic risk, they have a genetic risk to have high LDL cholesterol. Those people are hardest to bring their numbers down. If they didn't eat that way though, their numbers would skyrocket. And I've seen that where I've had patients who have that high genetic risk for high cholesterol and they are with that poor lifestyle, they have LDLs in the 200s, which is very bad. And when they have a good lifestyle, their LDL is 120, which is still too high if you have heart disease, but that's an 80-point drop with a lifestyle improvement. So yes, there are people that no matter what are going to need to be on statins. And so that's okay. That's not failure of lifestyle. That just means that you need both. There's no shame in that. There is no, it's this funny community, the plant-based group. They can be quite judgmental about how you, oh my God, I need to take a medicine. And that's a failure. I don't see that. You do the best you can and you get your numbers down, however you need to get them down. Now the question about the carnivore diet. So carnivore diets are wide. A lot of people eat different types of carnivore diets and there's a lot of variety, I should say. So if you think of like a keto diet, which is in generally very high in fat, like 75% fat, moderate protein, low in carbohydrate, or like a paleo diet, which is low carb and lean meats. So let's talk about keto, because I think most people, when they talk about carnivore diet, they're talking about that. So the reason that sometimes these people lose weight is because they've cut out their carbs. If you cut out carbohydrates, you will lose weight. Okay, so that is definite. That's been studied over and over again. You will lose weight if you cut carbs. So it doesn't mean that we should be cutting as many carbs as they like to cut, but you will lose weight. Regarding cholesterol, some people who eat a low carb, a ketogenic type diet will have a very low cholesterol, but so many people will not. In other words, we studied this and there's a huge variety in LDL among people with a ketogenic diet. I have put in more stents in patients on a keto diet than I'd like to say, because they'll come in and they said, well, we just eat keto, but doc, I'm having chest pain. So it's not that every person is, the other thing the others should think about is that meats and animal products aren't just about LDL. They also will trigger inflammation, right? They activate TMAO, which is a metabolite that your gut makes, which if it's increased is associated with heart disease. All of these things happen when you eat a high red meat or animal fat diet. So you have to be kind of careful because of multiple reasons. So don't just focus on LDL, focus on the whole package. How's the blood pressure? How's the weight? How's the stress level? How's the sugar? How's the inflammation? All of those things are important, not just one thing.
We had one question back here that I thought was kind of interesting, and you can be the person to answer this for sure. This was from Padjane Murphy, and she wants to know, once you're diagnosed with RA, rheumatoid arthritis, can you be cured?
Depends who you talk to. My said, there is no cure for this illness. Get used to it, kid. So for 10 years, I checked my markers. I've now 10 years out, I've checked my rheumatoid marker, and it's never been normal. So I've never been able to decrease or remove the gene expression. Not yet. I'm still working on it, but I have not yet in 10 years removed the gene expression. And the fact that 3 months ago, I had a joint that swelled suggests that I am still at risk. But I think there's a point where you can switch off the gene, but it's never been proven. So the answer is to be continued on that.
Mhm.
And I think that even if you're not cured or cured, I wouldn't focus on that. I would focus on whether that gene is expressing and you have inflammation, because right now I don't have the inflammation. And so who cares if I have the illness or not?
Mm-hmm. Yeah. I'm going to share something that when I saw you do it, I thought, oh, that's so interesting. You talked about the gut, and I want to go to those slides on the gut. Oh, this is the one. You said you were a cardiologist obsessed with poop. So can you talk to us about our poop?
Well, even one of the questions on my questionnaire is about your bowels. And I have many patients who say, oh, it's normal for me not to poop but every couple of days. That's not normal. Your body should be excreting contents regularly. The number of times a day or the number of times per week is not relevant, but it's not normal to not poop or to wait a couple of days without pooping. So the reason people say that I'm a cardiologist obsessed with poop, or that I say that, is because I think that the key to most illness has to do with the gut flora. And if you fix the gut flora and heal the gut, you can decrease your inflammation. So that's why when a couple of months ago, I developed a little bit of inflammation, the first place I went to was my gut. And I added in a bunch of natural probiotics. I gave myself more prebiotics. And I'm talking about through my foods. I don't take oral supplements for that. And then, and my body healed again. So everything goes through the stool. I mean, there's more to it. It's not just the gut. It's sympathetic markers, it's stress, but all of those things have some role with the gut too. Mm-hmm. So for instance, if you have a lot of stress in your life, that can impact your gut flora, which is amazing. You have to remember that there's like 90 trillion bacteria in your gut. And all of that bacteria has its own DNA. And so imagine that you have the DNA you have on your 46 chromosomes that are human, but you also have all that bacteria in your gut, which has its own DNA, which is also contributing to how you feel. Think about serotonin. For those of you who don't know, serotonin is your happy hormone. So that's why, like antidepressants, what they do is they increase the serotonin in your body. But serotonin isn't just made in the body, or rather in other parts of the human. They're also made by the gut bugs. So think about irritable bowel syndrome. Irritable bowel syndrome is every time I get anxious, nervous, my gut becomes unhappy. That's a simplistic answer. I mean, there's more to it. But you know that people who have irritable bowel are often depressed. So nobody's actually studied to look at, but there is relations that people are finding now, that if you give people who have problems with depression and psychiatric illness and brain issues, if you fix their gut with probiotics, you make them better. In fact, there's studies on autistic children now and giving them probiotics and whether that will help some of their autistic behaviors. I mean, it's incredible. All through the gut, baby, all through the gut.
Mhm.
Oh.
Okay. Any other questions we can pick up? Oh, here's one. Valerie wants to know about testing for inflammation.
Yeah, a lot of people ask that question. It's a good question. It's just that it's not as easy as the question, unfortunately, because we only have 2 real inflammatory tests that are in the common lab. One is your ESR, or your sedimentation rate, and one is your CRP. And I check the CRP a lot, which is the C-reactive protein. So the problem is there are so many more inflammatory markers that we don't test in the normal lab, and none of your doctors are going to really test for you because the normal confused. So in my studies, I check other inflammatory markers, but in general, the lay public, or the public rather, doesn't really have access to those markers. So in other words, if you have normal CRP and ESR, does that mean you're normal? Well, I think typically I tell people it's how you feel. If your body is telling you you're good, you're probably good. But what I mean by that is, do you have energy? Do your joints hurt? Do you feel happy? Do your bowels work? If those are all true, then you probably don't have inflammation. But if you have some of those things, some part of your body is probably not happy.
Okay, and then we have, going back again, I guess, to that extra fat would be the vegan keto. What about that?
Yeah, definitely a better choice than a keto, carnivore keto diet. But, the amount of fat in that diet troubles me. Low carb is not, we're obsessed with our weights. I know that. We all are guilty of that, including myself. And weight is important because you're going to be at higher risk for high blood pressure and diabetes if you carry more weight. So that's true. But eating low carb is not the answer. The studies show that you should eat between 50 to 55% of your diet per day should be carbs. The problem is most people are eating the wrong kind of carbs. They're eating like refined carbohydrates. When we're talking about carbs, we want people to eat complex carbs, right? So like millet and oats and whole wheat, those are complex carbs. Potato and beans, not crackers and chips, cookies and cakes.
And one that, whoops, there we go. You write in your book that having diabetes puts us at significant risk for heart disease. By the way, we keep talking about your book, and I don't know, Vicki, can you put me in spotlight real quick so we can show the book in case people don't know about it? There we go. So this is the book we keep quoting, and I would highly recommend the book to you if you haven't looked at it. In fact, I wrote my first positive review on Google the other day, on Amazon, about the book, because I'd never done that before, and because I want everybody to know about this book. It's just fantastic. It's got every element of lifestyle that you want to address. But the thing that I'm always concerned about is this connection with diabetes and heart disease. I think Dr. Greger says that most diabetics don't actually end up in dialysis because they die first from heart disease. What can you tell us about that?
It's true. So, again, so maybe people don't understand what diabetes is, and people know it's sugar, but I don't think it's fully understood. So your body's job when you eat something with sugar, and just like any meal you eat, and not just simple sugars, but like complex, your body, and you activate insulin. And the insulin's job is to, among many things, it has many jobs with protein, but related to sugar, its job is to take those sugars and turn them into fat. If you don't metabolize it by exercising or using it in other ways, your day-to-day, then your insulin will activate, turn the sugar into fat. That's a good thing. What you don't want is sugar to be floating around your bloodstream, because that is highly inflammatory and irritates all the blood vessels, creates endothelial dysfunction, and creates heart disease. So when you eat more and more foods that have high in sugar, so that's a normal response. We want that to happen. And so you want insulin to activate. But when you eat foods like crackers, those have a low glycemic index. So I mean, they don't take very long to process. So what happens is your insulin level goes up very fast. Whereas if you eat beans or lentils, your insulin level goes up a lot slower. That's good. You don't want it to go up fast. So what happens is over time, if you activate your insulin fast, you eat high glycemic index foods, what you end up doing is you gain weight because you have more sugar than your body needs. You don't use it all. So what happens is you gain weight. And we're not exactly sure why or how, but there's theories about the adipose cell or the fat cell creating something called insulin resistance. So basically what happens is that the big fat cell makes your body less sensitive to insulin. So this is a real problem. And we see this in obesity a lot, because as you gain more weight, the insulin you have, it just doesn't work as well. So it can't make the sugar go into fat. So that's a problem. Then the sugar floats around your bloodstream. That's diabetes. The more sugar that floats around your bloodstream, it damages all the blood vessels of your body. Your head, so you are at higher risk for stroke as a diabetic. Your neck, you can get clogs in your neck. Your heart, which is why they die of heart attacks. Your legs, so you get peripheral vascular disease or clogging in the legs. Why you lose blood from your toes. Why you get blood in your protein. Protein in your urine. That didn't make sense. Protein in your urine is because the sugar then damages the kidney, so you can't actually process the protein, and the protein leaks. And so you get protein in your urine, all because of diabetes. So every blood vessel in your body is damaged when you're diabetic. So one of the most important things you can do to decrease your risk is get rid of your diabetes.
Wow, that's for sure. Vicki, you had a question on an unusual ingredient.
I'm not even sure if I know how to pronounce it, but it's called boswellia. What is boswellia, and am I saying it correctly?
I think you're probably saying it as good as anyone else. You know, boswellia is another kind of anti-inflammatory food or supplement, rather. I don't know too much about it. It doesn't have a whole lot of data about it. In terms of anti-inflammatory supplements, the only one I recommend that I feel most comfortable with is turmeric.
Okay.
Perfect. And do you use any probiotics? Are there any probiotics that you can actually purchase and use, or do you just use the natural foods?
Yeah, I know it's hard. There was a study in the gut group that was published that looked at like 50 different probiotics, and like 2 of the 50 had the right strains of bacteria. And the truth is, I don't even know if that's true, because I don't even know if we know what the right strains of bugs are. And so it's the same thing with anything. If I take a green pepper or a red pepper, and I say that the red pepper has lycopene in it, and that's the good thing. So I'm going to take the lycopene out, and I'm going to take that, and I'm going to take it, and it's going to decrease my risk of prostate cancer. Well, is that true or not? I don't know, because is that the only thing in the red pepper? What about the other polyphenols that are in the pepper that could have been beneficial in decreasing your risk of prostate cancer? Similarly with the gut, I use natural probiotics because I don't think that there's just one bug, and I don't think we know which bugs are the right bacteria that we want to put in. Another example of this is patients who have weak guts or C. difficile colitis. Sometimes we have to give them fecal transplants. We don't just give them probiotics because they don't often work. Sometimes we actually literally have to give them the poop of another person, because we need all those healthy bugs that are in that healthy person's gut to go into the new person.
Well,
Do you, on acid reflux, it's caused, some doctors say, Valerie says, that you've got low stomach acid. That's why you've gotten it. But what do you think about HCI supplements and just supplements in general? You've kind of spoken to, haven't you?
Well, I mean, gastric reflux is not just one thing. Some people get it because they have high acid. Some people get it because they have too much abdominal fat. Some people get it because they have a hiatal hernia. There's so many things. So if you keep yourself trim, like then, and don't eat in the evening or late in the evening, you're going to decrease your risk of reflux. You just have to, I don't know, I'm not a big supplement person, as I've mentioned. I'm also not a big, you can use proton pump inhibitors and other sort of different therapies for acid reflux. But I think in general, the thing to do is to, again, go back to that lifestyle and try to keep those foods out, because there's some data that even eating Prilosec or proton pump inhibitors, it decreases absorption of things like calcium. And so that makes me nervous. So people are on those things for years. And then, and then they get osteoporosis, and we're adding medicines for osteoporosis. It's crazy. So I think reflux is one of those things that has multiple different causes. Some people have H. pylori. So it's worthwhile to see a gastro doc and figure out your trigger and see if there's something you can do. Tums overall is fairly benign if you have trouble with reflux. Not a bad, if you have something acute, or if you need something acute, take something for it. But in general, try to work on your lifestyle to make that better.
Okay. And if you're working on diet to do these things, is there some kind of a natural probiotic that you'd recommend, or an example of one?
So any like fermented food is going to be really good for your gut. So, right, those are all natural probiotics. Like is one of my favorite. I eat a lot of
Okay. And Dr. Aggarwal, did you happen to get a package from us?
I did.
Do you want to open it now?
I can. Yeah, sure.
Okay.
I have one more question.
Okay,
I have
go
one
ahead.
more question.
Uh-huh.
You talk about turmeric and recommending turmeric. Can you tell us how much turmeric a day is good? Is there an amount that is too much? Is there a place that we should be heading for with the amount of turmeric that we consume?
So you're going to hate me sounding like a broken record, but the best thing you can do is get it in your food. It does cause some reflux. So if you eat too much turmeric, then you might get a little reflux. If you take too much turmeric in a supplement, you could potentially get too much, and it can put you at risk for liver dysfunction and gallstones. So I do find that if you take it in your foods, then you're going to do great. Right now, because I just had that little flare, I do take some turmeric by supplement as well, because I really wanted to blast my body with extra turmeric. And I think the general rule is about, 500 milligrams. I have to check my notes, and I can send that to Kat and let her know.
That sounds good. It's also, you talk about it in that chapter on spices. We just had a session on, Debbie did for us on spices and sauces. And we were so excited to read your chapter to kind of prepare for it. So thank you for that chapter. Okay.
Really quick, the turmeric person, just real quick, if you're struggling for ways to put turmeric into your diet, because a lot of people say, I just eat it because it's bitter. I get that. Try to be creative with it. Like, put it into things like your oatmeal, and just like put a very little bit. And when I say little, I mean like a pinch, and start a pinch, so you can start develop a taste for it, and then start putting it in stews. Start with a pinch and see how you do. Like, I'm to the point, and I'm so adapted to it that I can take a half a teaspoon and I would be fine. But you have to develop a taste for it because it's very, very bitter. So over time, you'll start adding it to drinks and tea like I do. But for now, if you don't like it, just get some turmeric, be creative, throw it into just put a pinch though. And then as you start getting more and more comfortable with it, you can start adding more and more.
Great. Super. Thank you so much. And thanks everybody for using the chat too. We had a lot of good questions there. Okay, if you got a package and it's convenient, do you mind opening it for us?
Oh, sure, sure.
Great.
Just 57th minute. Okay, great. Let's do it.
You went 57 minutes. That's pretty darn good. Oh,
Okay.
goodness. And thank you all for sticking with us after we had that little problem at the beginning. We're just not sure exactly what happened, but now we can see what Dr. Aggarwal got. This is our thank you from to Dr. Aggarwal for doing this for us. You know, we've had a Zoom with Dr. Greger, and he did the same thing. He exercised the whole time. So,
Yeah, I find that, you know, I find that sometimes you got to just, you want to sort of do all these different things, and so you do the best you can, and you get a little bit of exercise and you're happy.
yeah.
Oh, I love it. It's very cute. At the Aggarwal salad, greens have to be bigger than your head with lots of green leafy vegetables, no pretend lettuce like iceberg. That is also very true. All very Thank you for sending. That's very cute.
Sure. And thank you for that quote. I mean, tell us about the salad and what it should look like.
So I tell patients, because a lot of people send me pictures of their salads and they think, oh, you know, look, I'm eating a salad, just like you said. I'm like, no, that's not what I said. I said, I want you to eat a salad that's bigger than your head. So the salad should be bigger than your head. So that means it should be this big. And what I mean by that is it should not be filled with all those other things to make it bigger than your head, but the greens portion should be bigger than your head. And then you add in whatever you like. Is there one thing I'd recommend more than the other? No. If you like tomatoes, great. If you like peppers, great. If you like olives, great. If you like mushrooms, great. Broccoli, whatever you want, throw them in. I love chickpeas, so I put chickpeas in mine. I put nutritional yeast in mine because I really like the flavor of that for my B12. And so you throw all those things inside, and then I use balsamic vinegar, and then I just make it this big. And I like to use kale in my salad. Sometimes people say, oh, it's too bitter. Then try baby kale. That tends to be less bitter. You can try spinach. It just shouldn't be at the same every day. You can do mustard greens, which are really good, but spicy, or turnip greens, which are good. Sometimes I'll do beet greens. And so I vary it up because, for instance, beet greens and escarole and arugula are high in nitric oxide and they dilate blood vessels. So that's good. And kale is really high in calcium and vitamin K, which is really good, especially if you eat plant-based, you need your calcium from your greens. So that's good. And then spinach is really high in iron. And if you still menstruate or if you have iron deficiency, you're going to need that iron. So all these different things have different benefits. So you never really want to eat the same thing every day, and you want to have a lot of variety. And I'm showing you my hands, actually. I just noticed them. You can see I really have no joint inflammation at all.
Congratulations. Hey, on that great salad, do you put your favorite fermented food? And what would that be if you did?
Kimchi.
Kimchi. Okay, great.
Like
That one-
there are many
Yeah.
other things. Sauerkraut is fine too. I just like kimchi.
Well, Dr. Aggarwal, thank you so much. And we thank all of you for asking questions. And it's about time for us to finish. So we're going to say goodbye to you and the rest of us. Before we leave, we want to tell you what we're doing next. And next, we've got a Zoom coming up with Dr. Barnard. Bye-bye, Dr. Aggarwal. Thank you again.
Guys, bye.
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 Okay, Debbie, tell us about what's coming up next. Let's put her in spotlight so we can do that.
Yes, so on November 4th at 11:50, we are going to be here on Zoom with Dr. Neal Barnard. He's going to be talking about his book, his latest book that came out last year, Your Body in Balance. And that's all about hormones, how your hormones affect your sleep, how they affect your menstrual cycle, PSOC, all sorts of things. So certainly everybody needs to sign up for that. And Kathy, I believe you're going to be putting the link to the Eventbrite registration for Dr. Barnard and the YouTube for this meeting, correct?
Yes, and it's also in the chat. So it's going to be in both places. Chat for us today. Thank you, Linda, for
Okay.
putting it there. And it will also be at the bottom of the YouTube. And remember, our YouTube is being live streamed, and then it's kept up there, this Zoom, so you can send your friends to the actual event that you just attended if they're interested as well. Anything else, Debbie?
Well, if I can just mention that on November 1, I am starting a free series. It's a Food for Life series on diabetes, and it's right in time for the holidays. And I will be using a lot of holiday recipes in that class. It is free. It's through Veg Fund. Of course, Food for Life is through the Physicians Committee for Responsible Medicine. So certainly I would love for everybody to sign up for that as well. And it will be on every Monday for 6 weeks from 6 p.m. to 8 o'clock. Okay? Thank
Sounds
you.
great. Thank you, Debbie. And we'll put that in the next newsletter that's going out too, because I wanted to advertise it there. So thanks everybody for coming today.